Good morning, everybody, again, and welcome to ChamberLIVE, which is managing health and safety at work during a pandemic. The views expressed in this seminar don't necessarily represent the views of the East Lancashire Chamber of Commerce, although we tend to agree with Chris most of the time. And all the facts were believed to be correct at the time of recording on the 22nd of April 2020. Thank you for participating in this event. We hope that you gain some valuable information from it. We're very grateful for the support of our sponsor Intersolia, whose name is appearing behind me here. They understand, like us, the pressure that businesses are under during these unprecedented times. And as a gesture of solidarity, they're offering businesses who registered for this event their own web-based COSHH management solution. It's called iChemistry. It's tailored specifically to your needs, and it's free of charge for the first 6 months, subject to some T's and C's, as long as you quote the ChamberLIVE event offer when inquiring. If you'd like to take advantage of the offer, if you'd like more information, Debbie's going to put the contact us link in the chat now. If you're watching the video on replay, it'll be in the comments on the video on YouTube, and there's a caption at the beginning and the end of the video. Just remember to quote the ChamberLIVE event offer. I'm hopeful, I can't see him, but I'm hopeful that Tim O'Donnell is with us. Morning, Tim, and thanks for your support again. And Debbie's going to email details of that offer in the post-event email. Now, time to introduce Chris. As I mentioned at the beginning, he's got more letters after his name than, well, he must have, his business cards must be long and rectangular. He's a Chartered Occupational Safety and Health Practitioner, Chair of COSHH, Manchester and North West Districts Branch, and a Fellow of the International Institute of Risk and Safety Managers, the Chartered Management Institute, and the International Safety, Quality and Environmental Management Association. He's got 15 years of experience in health and safety consultancy, and he's going to share that experience with us now. So I will shut up and hand over to Mr. Nag. Over to you, Chris.
Unmute. Thank you, Simon. Morning, everybody. It's a pleasure to be here. I've spoken at East Lancashire Chamber before. Last time was on accident reporting. This is uncharted territory for a lot of us, as is the health and safety practitioners. I'm just going to share my screen. Let me go with that and share that. And I now can't see what I want. That's it. Can everybody see that? Nod. Yes, Simon. Yeah, good. Thumbs up. That's great. So what I thought I'd do this morning is really just to start a debate, and I'm not going to witter on about health and safety per se in any real detail. I'm going to mention a few points that have come out of sort of discussions over the last 3-4 weeks, some experiences, things that are starting to create interest or debate among safety professionals, and a little bit about what businesses should be looking at, indeed, if you haven't even started to think about health and safety in context of the pandemic. So if this works, there we go. Simon did a very nice introduction. Thank you, Simon. I have been in business for 15 years, actually 20 years in health and safety. I actually started my health and safety career in the cable television world many years ago, but since then I've been involved with all sorts of industries and studied and got where I am. So I'm a seasoned health and safety professional. I wanted to talk today a little bit about health and safety at work during the crisis, a little bit about the recovery phase and what we should be looking at and sort of starting to think about, because we're very much not in the recovery phase yet. We're still in the incident phase. Planning for a restart. Some businesses are actually still working, and that is amazing under very difficult circumstances. Some people have to work, are key workers, but some businesses have stopped or are having great difficulty in working, and we need to start thinking about how do we re-energise, restart, and what are the sort of things that we need to be thinking about in terms of managing health and safety going forward. And there's lots and lots of challenges and lots of things we ought to be thinking about. And probably things that we haven't even thought about yet. And part of the discussions that I've been having this last couple of weeks with my peers and my colleagues is what are the sort of things that we need to be putting on the table to actually start thinking about the restart. But even beyond that, I think we need to be thinking about the future. We need to be capturing the lessons learned now to actually think about what do we do next time this comes round, if it comes round again. And the experts seem to think that this could come round again. It could come round sooner than we think if we don't get the restart and the isolation timing correct. And in the future, this may be a thing that happens on a regular basis or irregular basis. But as a business, how do we actually cope with that? So what would we be doing now to prepare for that happening again is some of the discussion that I think we ought to be getting into. Sadly, 823 people died yesterday from COVID-19. It's likely that that number is going to be repeated again today, and that's going to be the story for the next few weeks and maybe worse. And in the northwest, the forecast is that it is going to get worse before it gets better. So we need to focus on that because that's reality. Reality is people are losing their life to this terrible disease every day. And as businesses, we have a responsibility for our employees. And as such, we need to take government advice very seriously. Unfortunately, government advice can be somewhat confusing because on the one hand, we're being told, please stay at home, protect the NHS and save lives. Great advice, seems to be working. The scientists and the statisticians are forecasting that what we're doing is actually flattening the curve. But on the other hand, they're saying, the government is not saying only people doing essential work can go to work. Anyone who cannot work from home can still go to work. So it's a challenge, it's a difficult one because businesses on the one, they're saying we need to survive financially. So we need staff in, we need to be making product, we need to be working. And on the other hand, the government's saying stay at home unless you actually need to go to work. And it can be extremely confusing when you're doing your assessment of risk and when you're doing your business planning. But I just want to ground everybody back to the fact that 891 people are likely died yesterday, and today it's likely to be a similar number. So whatever decisions we make, whatever risk management, whatever health and safety management decisions we make, the reality of it is people are still dying, and we need to really think hard about that fact when we're doing our assessments and our critical thinking and our decision making. So the last comment on there is information overload. I just heard Simon say that there is the COVID resource page at East Lancs Chamber of Commerce. You only need to look at the television, you only need to look at the internet, you only need to look anywhere, and there's a vast amount of information, some of it very much conflicting, some of it confusing, some of it very clear. But the problem is there's an awful lot of it, and everybody interprets that information in their own way and in different ways depending on the pressures that they're under. But just bear in mind that the Health and Safety at Work Act 1974 still applies to the working environment, and that puts a responsibility with the employer for the health and safety of their employees. And that's the foundation of the law in terms of Health and Safety at Work Act, Health and Safety at Work in the UK. So we've got a little bit of a poll as we're going through, a little bit of interactive poll questions that we're going to throw in every now and again. And so I'm going to ask the first question, if I may, Simon, which is, does every business need to have access to one or more competent health and safety advisors? Yes or no? Answer now. Health and safety professionals will know this, and I know there are one or two on this call, so I'd expect you to get this one right. And Simon's doing his magic, he's just giving you time, and we should have right. Well, that's interesting. 77% of you say yes, and 23% no. Well, he says in the next slide. The Management of Health and Safety Regulations 1999, which is a subordinate piece of legislation that underpins the Health and Safety at Work Act, actually has a requirement under Regulation 7 that every employer shall appoint one or more competent persons to assist in undertaking the measures he needs to take to comply with requirements and prohibitions imposed upon him by or under the relevant statutory provisions. Well, what that basically says is the answer is yes. Every business needs to have access, not necessarily employ directly, but needs to have access to good quality, competent health and safety advice. And one of the things that is sometimes not clearly understood, especially by smaller businesses, is what does that actually mean in reality? What does competent health and safety advice mean? How do you know that you're getting competent advice, and who should you be going to for competent health and safety advice? And again, the East Lancashire Chamber of Commerce are well equipped for providing small business with that sort of advice, but recruitment companies and people who are looking to employ competent health and safety advice really need to sort of look at what that actually means. And the IOSH badge, which is up on my left shoulder, or your right, is one place where you could go and look for qualified and competent advice, people who have the IOSH training, people who have gone through the chartership, people who have got experience through time and experience can become chartered, as I am. And so making sure you get the right qualifications, people with the right qualifications and experience, is so important, and even more so nowadays, that competent advice is so important in this particular crisis, in that people with the competence, first of all, they know what they don't know, so they won't be telling you to do things that they don't understand or they don't know. They won't be interpreting the guidance and legislation that's been provided unless they're actually confident in doing that. And they really, really will be working in your best interest. So my advice is, if you haven't got competent advice, health and safety advice, and you haven't got them advising your business, it's something you might want to give that some thought and go and search that out, or even talk to the East Lancashire Chamber of Commerce and see how they can contribute to the decision making going through this this terrible time that we're in. So that's slide number 7. So Simon, can we post the next question, please? So when should you review your risk assessment? So I'm sitting there brewing whilst I'm waiting for the answers. So, you know, when should you review your risk assessment? So,
just waiting for the last. I'm just waiting for the last couple of votes to come in, but they're dragging their feet, so I'll just go without them. Yeah, okay. Here we go.
The answers. Oh, right, we've got some, yeah, definitely. So annually, after a significant change, after an accident to failure, before you start work on a new task. And what's a risk assessment? I'm glad somebody didn't say what is a risk assessment. You're right, but the most important one here is after significant change. I think we can class a pandemic as a significant change. And really, risk assessment is the starting point for any control measure in a business. But if you've got risk assessments in place at the moment, whether it be general health and safety risk assessments or fire risk assessments, as we heard yesterday, if anybody joined the webinar that we hosted yesterday at COSHH, a pandemic and the impact of that pandemic on your business is a significant change. And therefore, you could follow on from that most of your risk assessments, if not all your risk assessments, currently out of date and need to be reviewed. They need to be reviewed on the basis that you may not have the skill or ability to be able to deliver things safely, work safely. You may have lost skill, you may have lost numbers of people, you may have lost systems. Systems may have become out of date in terms of test and inspection. And there's a whole raft of things that you need to start thinking about. So you really should be dynamically assessing, reassessing, and having a look at your risk assessments. And I would suggest that as the weeks go by, those risk assessments need to be reviewed fairly regularly, because there will be, I'm sure, more changes in the coming months. Your supply chains may become even harder to work with. You might find that you lose staff and you lose skill set as things get progressively tighter or they get worse in terms of people becoming ill. So there's lots of what ifs, but if you use your risk assessment as it should be, you need to use that as a tool to help you start looking at this in detail. So risk assessments definitely need to be reviewed after significant change, but yes, annual is a good idea, and after an accident or failure and so on. So there are also some specialist risk assessments that you need to think about in your general risk assessments. Your general risk assessments will point you towards other risk assessment requirements. And one in particular that is quite important right now is COSHH, and the control of substances hazardous to health. COSHH actually covers biohazards, and as COVID-19, the coronavirus, is a biohazard, it should be thought about in your COSHH assessment. And certainly if you are working and you have people working in your places of work, then you certainly ought to be looking at COSHH and the risk assessment in terms of social distancing, in terms of cleaning and keeping the place clean and tidy. And it's also interesting to note that recently the approved list of biological agents, the coronavirus MERS-CoV, as the group's called, was previously unlisted, but it's now been added to that list as hazard group 3, which has another implication, which we'll come on to shortly. Simon, could you fire the next poll question, please? So, if an employee is infected by COVID-19 at work, is it reportable? Don't worry if you don't understand what that means, I'll explain that shortly, but is it reportable to the enforcing authorities? Here it comes. 54% yes, 21% no, 25% don't know. Okay. Well, there has been somewhat of a big debate over this, especially how it applies to a healthcare setting. But the HSE have actually issued guidance on the fact that there are two ways in which you will have to, two reasons why you must report infections or deaths related to COVID-19 at work. So if you're an employer and it's determined that there's been an infection at work, in the workplace, that's resulted from exposure to COVID-19 whilst at work, then you will be expected to report that to the HSE under the Reporting of Injuries, Diseases and Dangerous Occurrence Regulations 2013. That's caused quite a bit of debate and quite a bit of concern. And it's also started a debate on how you actually go about proving infection route and when somebody's infected, given the fact that there is a potentially 14-day incubation period for COVID-19. We're actually looking at this with some legal advisors at the moment, with Pinsent Mason and other legal advisors, to try and get an understanding of how this may work in terms of a report and maybe an investigation. But it is something, as an employer, if you do have somebody infected and it does look like it happened at work, then you will be required to report it, and there could possibly be consequences as a result of that. Just whilst we're on reporting as well, some of you may already have experienced this, but the HSE have actually started looking at incidents of breaches of social distancing in the workplace. I dealt with one last week where somebody had complained to the HSE anonymously that social distancing hadn't been achieved properly in the workplace. The HSE got involved. We've had to give the HSE a very detailed explanation and demonstrate that we've risk assessed and put good control measures in place. And I'm pleased to announce that we were successful in defending that. But there may be more cases of that where people, and quite rightly, because they're concerned about their own safety, about the safety of their families and their friends, you know, being in a workplace with others, coming into contact with other people and surfaces and so on. People will be concerned, they will be worried, and some people react in different ways to that. And there are mechanisms in place for people to anonymously report employers to the enforcing authorities, and the enforcing authority, the HSE in this case, are taking an interest in it. So that's something very much to bear in mind. So. Homeworking's been a big subject. Suddenly we've all, or many of us, have suddenly had to set up offices at home. And I noticed Janet's got some good provisions hanging from her wall behind her, and I've got a nice collection of whiskey, and I've hidden that out of sight because I don't want too many people to know that. There's been lots and lots of debate about does health and safety apply at home? What should we be doing? Should we be worried about the fact that everybody suddenly started work at home? Do we have to do DSE assessments, display screen equipment assessments? The reality of it is that if an employee is working at home, then that home becomes a workplace. It is a workplace. The employer has got responsibilities. People have had to change to home working very, very rapidly and very quickly. The longer this lockdown progresses and remains, then employers that have sort of got into the swing of people working at home might want to start looking at and doing some assessments and risk assessing the setups that people have. I read an article this morning that there's people complaining about backache and back pain because they haven't got the ergonomic seating and so on and so forth. If this lockdown lasts for a long time, then there will be, I'm sure, people complaining about poor workstations and poor posture and back pains and so on. So all the problems that we normally get in the office, I'm sure will start to come out over time. And it's something that you don't want to leave off your radar. It's something that you need to think about, and certainly spend a little bit of time making sure that your employees are comfortable, that they've got the workstation set up as best they can, and where the facilities aren't right, maybe make some reasonable adjustments if possible. But the message here is that as an employer, you still have a responsibility for your employees and the work that they're doing for you whilst they're in the home workplace setting. So it's 50. Another big subject is mental health and well-being. It's been a very big talked about subject this last 12 months or so, and there are people on the Zoom meeting that are specialists in this and experts in this. I don't think there's ever been a time when we need to be giving this some real momentum. And people's mental health and well-being, again, over time, as this stretches and gets longer, and as people are asked to come back to work, we will see the effects of this this pandemic manifesting itself in all sorts of different ways. But one of the positive messages that I've got is, like we're doing today with the Zoom meeting, I've been communicating with my clients and with my Irish colleagues and health and safety colleagues and family probably more in the last 4 weeks than I would normally do. I spent less time driving around in a vehicle and stuck in traffic jams, and that time has been used more productively. And I've even made social calls and that to people just to check on how people are, and generally, you know, put my arm around them. And it helps. Every little bit helps. Isolation is really, really bad. So one of the bits of advice I will give to anybody here is pick the phone up and just talk to people, or get on Zoom and get them talking and have 5 minutes, have a brew with them, ask them how they are, and really just think about their mental health and well-being. There are people that I've talked to this last week or so that are furloughed, with uncertain employment futures, they're previously professional, you know, decent jobs, and now they're looking at black hole, and it's really worrying them. So, you know, mental health and well-being is a subject that employers really need to have a think about, build it into their strategy, and look at ways of dealing that. It's better to deal with it now than try and clean it up afterwards. So, Simon, the final question, if you would, please. So, where would you go for good, competent, good quality health and safety advice? And don't point at me, whatever you do, don't point at me. I'm busy enough. Oh, here comes the answers. The HSE. That's an interesting one. Going to the HSE for good quality advice. Don't get me started. The HSE have got an awful lot of good quality information on the website, but you're right, all those people, all those organisations all have good quality advice that you can go and look at. The problem is it's information overload, and it brings me back to the point that I made earlier, and that is you need somebody competent in your business to actually help you untangle that from a health and safety point of view. That is just one of the many considerations as a business owner, as a business advisor, that you need to sort of think about. There's the financial, there's the resource in the supply chain, there's environmental considerations. There's a whole pile of things that need to be thought about right now. But I just want to finish this session as far as this is concerned. What do we need to think about going forward? Well, we need to think about the government's restrictions and the Public Health England requirements in terms of how do we keep this disease under control, and how do we minimise its impact, and how do we get out of this and get rid of it the first time and not expect and not allow it to come back. That's the first thing that I would say. Risk assessment. Risk assessment is the tool that you use to do the what-if scenarios, to think about how you're managing things, do the plan, do, check, act, circle on it, make sure that you have a plan, that it makes sense, that you've had good advice in those risk assessments, and that you actually turn those good intentions into reality. It's all right saying that you're going to try and socially distance people in the workplace, but is it actually practical to do? Can you actually achieve it? You know, don't do what the construction industry have done, and that is put a big pile of ovens out, and one of them says you can work together for 50 minutes, but no more than 15 minutes, as long as you don't, you know, you're allowed to actually touch each other for up to 15 minutes. And it's nonsense. You know, you make sure that your advice is clear and concise, but it makes sense. Safety critical work. You need to think about safety critical work. You need to make sure that you've got the right amount of manpower, or lady power, to be politically correct. Make sure that you've got the right skill sets. You need to also think about emergency conditions, because not everything goes to plan, and sometimes things go wrong. And when things go wrong, you need to have people there that know what to do. And so make sure you've got the right skill set to be able to carry on working. And the first aid provision is one that we've had lots of discussions about. You know, first aid and social distancing don't go hand in hand, but there are lots of good guidance and advice about how you can apply first aid and deal with first aid incidents now. And you need to get your first aiders up to speed in that respect. So planning for restart, defining the new normal. Well, that's a debate that's ongoing. I think new normal going forward, there may be a good case for a lot more home working. There's lots of people talking about how efficient and how well this home working has worked for some people. Again, that needs to be thought about from a risk assessment point of view. Plan, do, check, act. Information, instruction and supervision. When people do come back to work, if you've had people furloughed and that, you're going to have to get them back into the rhythm. You're going to have to re-induct, give them information, instruction, training and supervise them to make sure that, for example, your new rules in terms of social distancing can be achieved and properly implemented. Cleaning regimes, keeping things tidy and so on. Statutory checks and inspections. The HSE have made it very clear this last week that statutory checks and inspections do not stop as a result of COVID-19. If you have lifts, lifting equipment, pressure systems and so on, they still need to remain safe. And you need to have a plan of action in place to actually make sure that those stay safe, and especially when you come to restart. If you've got empty buildings that have been empty and shut down for some time, you need to think about reoccupation. You might need to do deep clean. You might need to get your Legionellas tests and inspections up to date. You might need to do some checks on your fire systems and so on. But the big thing on all that is you need to have a plan, because there's so much to think about. So get a plan in place and prioritise it. And that the start of a debate, I think, and I'm going to hand back to Simon for a Q&A, and I'm sure there will be one or two questions.
Yeah, there are. Brilliant. Thank you. Thank you, Chris. I've got a lot of questions, but I don't want to jump in and dominate with mine. So I'm going to introduce Dean. He's the first to raise his little blue hand. Good morning, Dean Williams.
Morning. How are you, Simon?
I'm well, thank you, sir. How are you?
Good. Smashing. I'm grand, thank you. I think we're all seeing some of the benefits as well, that the weather has had a lot of positives, that people that do work from home are able to break up the day and perhaps spend a bit of time enjoying some of the weather and enjoying time with the family. But in terms of the staff that are actually furloughed at the minute, I know you touched on, Chris, about the mental health aspect, and this can drive some people into the cabin fever, and they can slump into a very dark place. But in terms of those staff that are furloughed, what contact can employers make with their staff that are furloughed without breaking any of the working from home contact sort of ruling?
Well, I'm no expert on furlough, but I understand as long as they're not actually doing a job of work, there's absolutely no reason why an employer can't have a pastoral well-being, care, social care and responsibility approach to making sure that their staff, because they are their staff at the end of the day, remain in a good place. So, and I would say a good employer would be doing that on a regular basis, just putting their arm around them.
Yeah, just in a supportive, friendly sort of way, rather than saying, I've got you online, I want to talk about something that's happened in the last week.
As I understand, they can't do any work.
Yeah.
If they're doing work and they would normally get paid for it, they can't do that as long as they're furloughed. But in terms of duty of care and just general well-being and a good corporate social responsibility approach, you should be talking to your employees.
Champion.
Thanks,
I do
Dean.
have another question, but I'll let other people speak first.
All right, I'll come. Thanks, Dean, for that. I'll bring you back in a minute then. And yeah, from my understanding from one of the earlier sessions that we had around furloughing is exactly what Chris has said. You're allowed to personal development and team meetings are fine, but you're just not allowed to do anything that generates revenue, essentially. So certainly from a chamber point of view, we're involving all our furloughed staff on our weekly team meetings, just as a way of keeping everyone connected. I'm going to bring in Janet Nerenberg. I know you're working, aren't you? You're up and running still. So do you want to put your question direct to Chris, Janet?
Yeah, so I'll mute myself. So today is unusual that I am at home, so apologies for the wine in the background. I'm not drinking it at the moment. Chris, we've put loads of things in place: signage, floor markings, one-way systems in our canteens, etc. And we've got a limited number of staff on sites, but we do still see people gravitating together. So naturally, it's the instinct that they've got, and you go out into the sites and you'll see two people stood closer together than they should be. We're doing what we can in terms of policing that, but is that enough, or should we be doing something more?
It's a good question, is that. I would bring you back to your human resource approach to this, contracts of employment. This is a serious matter, and if people aren't following the rules, aren't following instructions, and so on, if they're willfully disobeying an employer's reasonable instructions, then disciplinary is one way. The other is that people need to get used to working in this new environment, the new normal. And so there needs to be a higher level of management and supervision. There needs to be people actually setting the examples from the top and so on, and actually get people to actually start doing things differently. So I think there's a broad range of approaches that can be took, but the reality of it is that if we don't, then the chances are we could be causing further spread of this disease. So, I think you've got to look at it in context and see what the problem is and see who the culprits are. But it might be that, and coming back to risk assessment, there may be certain pinch points that need to be looked at. There might be some crossing points. In fact, I'll when I get a minute, I'll send you a video that's been done by another company for you to have a look at, just to see the level of detail that another company's gone to. Unfortunately, I can't share this broadly, but this might help you, Janet.
Thanks, Chris.
Janet, how are you finding, do people respond when they're told, oh, you're too close? Are people okay with that? Do they get it? Or
They do, yeah, they do generally. I think we don't have anybody deliberately avoiding, deliberately ignoring the guidance that we've given. I think it's just natural human instinct that you want to talk to somebody and you gravitate towards them and you get a bit closer than you should. We are still manufacturing, so right the way through this crisis. I am on one site, I've got Colin who's on the call. On another site we don't have full health and safety cover because 2 of our team are furloughed at the moment. I think we're doing as much as we can, but like you, Chris, I'm concerned that the Northwest, we are still reaching that hiatus. We haven't spiked yet. And I'm starting to look at planning for the future. We've got a new induction document. We've got a questionnaire which will be used over the telephone for people who are on furlough coming back to work, asking them, have you got any concerns? Is there anything we need to consider for you before you come back to work? Because we are bringing some more people back in next week because we've got orders still coming in, some for the NHS, some for hospitals outside of the UK. So it's important work that we are doing. But I do have concerns still sometimes, even in the office. I was sat at my desk the other day and somebody came wandering up, and although I'm sat on a bank of desks on my own generally, somebody came wandering straight up and stood behind me and I went, oh my God, I'm really sorry, and stepped back. So it's just that natural instinct for people to want to do that. Yeah,
and I think there's going to be a lot of behavioural safety needs to be looked at, and this is where our psychologists, employment and health and safety psychology advisors will come in. So I don't think we have all the answers yet, and I think we've got some big challenges. What I would say, Janet, is you know where your peers are. Don't sit there lonely. We're happy to chat through things. So. Sorry, go on, Simon. All
right, no, thank you, Janet. Amanda, you might keep some muting. Is that because you've got a question, or are you just having technical problems?
No, I'm okay. But yes, I have got a question.
Okay.
Is that okay?
Yeah, go for it. Yeah.
I think we, in my view, have done a lot of research through public health in surrounding the two viruses that we're currently dealing with as a pandemic. Can I just say, with having a lot of experience in different industrial areas too, and with professional corporate governance, it's really important through HR, even if you're a really small business, to ensure you understand how the virus is transmitted. And I know we get rules and regulations through public health, through HSE, etc., to change the way we work just slightly with PPE, etc. But for each individual industry that you are dealing with, it is absolutely paramount that you understand how the viruses are transmitted, because it can be the slightest little thing that you can change, and it might be at the bottom of a regulation that you've missed. It's really, really important, because it's usually those things, and it's one of those things that you'll go home when we all go. That you go home and you think, oh, I wish I'd not done that now, or I can now understand how that virus is transmitted or absorbed into the atmosphere, because a lot of this has transpired because everybody just gets on, don't they? And they must slightly, really small things, and that's what happens in a pandemic. So that, for me, is really, really paramount.
Thanks, Amanda. Chris, do you want to come back on that? I've got another half a dozen questions as well. So,
I'm mindful of time, but very quickly, the routes of transmission are really important, and the areas that certainly we focused on. We had the HSE involvement. One was information, instruction, training, supervision, making sure people understand how they must behave in the workplace in the new normal. Secondly was making sure that people didn't come into work and they weren't under any pressure to come into work if they in any way had symptoms or they were living with people with that disease. So the pressure wasn't there. And the other thing that we've looked at in some detail is the cleaning regime and the people actually doing the cleaning, because they are employees as well, and they're in frontline defence and making sure that they've got the right equipment, the right cleaning products, and the right methodology, and the things that they were actually expected to clean on a very regular basis. Things like touch points where people regularly transverse through buildings, door plates, switches, keyboards, forklift truck controls, anywhere where there's a regular contact between people and surfaces. So it is really important. And coming back to the HR thing, there needs to be good quality health, human resource, contracts of employment and everything in place, so people understand that if they willfully disobey the reasonable instructions, then there is recourse, because there may be people who need to be sort of dealt with through the disciplinary procedure. Sorry, I'll stop at that one there, because there's a lot more to that. So.
All right, we've got 8 minutes. I'm going to try and get in Ashley, Simon, Catherine, Jen, and Dean again. So we'll go Catherine first. Do you want to come in first?
Yeah, sure. Thank you very much, everyone. This is really interesting of Chris to raise this and have the breadth of all the matters. And I really like the idea that we're seeing this as a matter that sort of has what was before, a starting process, a kind of continuation, and maybe at some point after the event. However, what from my interest, of course, is from a psychological point of view, and I have a couple of things about psychological safety. And Chris has mentioned about mental health and well-being, just to point out that, yes, that people's responses are very different. People's responses to anxiety are different. They may have existing difficulties already. But I think also, and this is what we don't know, is actually how are people affected by the various different ways that businesses have responded. So some businesses have kind of really had a massive impact and innovated and done all sorts of things right from the word go, and have actually been in high demand. Maybe they've actually had such high demand that people have actually struggled because of that, or maybe that's been energizing. There are, for people who are working at home, maybe that home is not necessarily a safe place to work. So, and that is a big matter for considering a psychologically safe workplace. And one of the things I'm interested in, and I've tried to draft a bit of a questionnaire, I'd be interested in seeing how people, where this is of interest really, is just a bit of a questionnaire about people's responses to their different work situations, to whether they've been furloughed, to whether their business has closed, to whether their business has kind of responded to demand and changed in what it can do. So I just would be interested in some comments back from people, whether that is something that I could put through the Chamber of Commerce, about whether or not you would be interested. It's partly an individual response, but it's also at a business level to know how your staff are responding to their different work situations. I know that can be done, as Janet was talking about, by asking people, but this might just be a way of checking through with a number of people how they are feeling at the moment.
Well, I'll take that, Chris, if you like. Catherine, absolutely, it's definitely on our agenda for a future Chamber Live event. So that survey and the intel from that survey would be useful for us. So if you liaise with Debbie after this, then we can put that survey in the follow-up email from this event, and then all the delegates can get that if you're happy to do that.
Yep, fine. Okay, thank you. Thanks. Take care.
Okay, great. Janet from Senators certainly interested to see it as well. I've just seen in the comments as well. Thank you, Catherine. Simon, Joseph, do you want to come in?
Hello. Yeah. Obviously, we've had enormous changes at the hospice. So, you know, I've done most of the things Chris has suggested, reviewing over 150 risk assessments and all of that. And we've had huge issues with PPE and getting people protected. There's one little tweak, really, I'm not sure about how we manage those staff that don't want to come to work because they don't feel safe now that we're treating COVID patients, but we think they should come to work. And conversely, there's a small number of people that keep coming back to work even though we've advised them to work from home. It's how we deal with those people carefully and sensitively, really. Any suggestions on that?
Short answer, no. we're in a really difficult learning. I mean, Catherine Dobson may be able to help you with some aspects of that. It's down to individuals, and you know, like I said, people are very scared of this. Some people are blasé about this. Some people still don't understand what's going on. And other people are absolutely terrified about it, you know. And you're having to deal with all those emotions and that. The fundamental thing about coming back to work is to create a safe place of work so far as is reasonable and practical to do. And unfortunately, we're dealing with a deadly health issue. And if we get it wrong, we know what the issue is, we know what the consequence is, and we know that there is a potential for people to lose their lives. And that understanding has got to be from the very top of the organisation. When they're making the decisions and they're considering some of the issues that you've got, that's got to be in the forefront of people's minds. We have to continue as a society. We have to continue to work. We need to manufacture food. We need to grow food. We need to look after people. We need to put fires out. We need to, you know, we need to exist. But there has to be a balance, and getting that balance right at the moment, it's a really difficult conversation, and that's why there needs to be informed, accurate, clear understanding of the information that's been put before us, and it's a multidisciplinary team that needs to look at those issues that you've got to think.
Yeah, I mean, it's very challenging in the hospice because we are looking after patients who've got COVID-19 who are at the end of life.
Yeah.
We haven't had any evidence of transmission within the hospice, but it's a very challenging time for all of us, really.
I understand it's
hugely complicated.
I've been doing some work with the East Lancashire Hospice in Blackburn with Sharon Crimble and the team there, and I fully understand where you're coming from. So, Simon?
All right, thank you, Simon. Ashley, do you want to come in briefly?
Hi folks, how are you?
Hi, Ashley.
Oh, he's a ringer. He's a ringer.
So great gig, Chris. Thanks for that. Just a quick show of hands, really. So just give us a wave if you've currently got health and safety advice in your company. Cool. How many companies that are on? We've got 34 on, I think. How many have furloughed that health and safety?
2, yeah.
Just 2. Cool. That's great. Thanks. Just instant observation. When all of this went south, most of the HR and health and safety team were furloughed within our company. So literally, we got pushed out the door before we had a chance to make any decisions. Just wondering who else might have been in a similar position.
Mm.
Okay, thanks.
All right, thanks, Ashley. Dean, we said we're going to come back to you. Has your question been answered subsequently, or do you want to come back? And we're right on the knocker though, so keep it super brief, please.
Yes, in terms of the DSE assessments, we're expecting employees now working from home to do their own DSE assessment. Would that be right?
It is an approach. There is a self-assessment form that you can download from the HSE's website, and that's a starting point. The other is, you know, some simple things. You could get the employee to take some photographs of the workstation, email those in to you so you can have a look remotely. And there's lots of good advice. The issues, most of the issues I'm sure you'll come across will be things like posture and, space and, and some of those things. Well, what you've got to do is look at it really from a health risk point of view. And you're going to have to be adaptable, pragmatic and reasonable about some of the things that you're going to be able to expect from people in their own homes.
Yeah, I think there's some companies that are fearful of employees doing their own DSE assessment and almost claim that they've got to get a full workstation with desk risers, multiple screens, a new chair, a new desk, because normally they would just sit on their lap with their laptop, and now because it's a workplace assessment at home, they're putting in all sorts of expenses claims to get an all new workstation. So there's going to be a bit of sweetness, I think, about it.
Let's put this into context, right? There are people dying every day as a result of exposure to a disease we can't see. And we have to set some priorities in a business. And I'm not saying that DSE is not important. What I'm saying is it might be fairly low down on your priorities. But if you've got an employee that you know had difficulties at work, that you've made reasonable adjustments for, and that you know that they're in a position where they're having to work at home, and they may not have their a good workstation and the necessary resources to do that, you might want to pick that up as a priority and say, right, well, let's deal with that because we know that's a problem, and then come back to the others over time. But focus your energies on dealing with death and destruction first. This COVID issue needs to be taking a higher priority over DSE assessments.
Thanks, Chris.
Brilliant. Thank you, Chris. And we're going to wrap it there because we're right on, it's 11:33 now. So can I just ask for a visual round of applause for our speaker, Mr. Chris Nagg, with all the letters. Everybody. I won't read the letters again. No. Thanks, Chris. Great job. A huge thank you to our sponsors, Intersolia. Don't forget that offer that will appear in the follow-up email. It's already in the chat box. And if you look at the comments section on YouTube, you'll find details of the trial of the COSHH management system for 6 months for all businesses. Just a reminder that for Chamber members, you do have access to Chamber Protect, which does include some health and safety helpline and document library, which you may find. I know a lot of our members have been using that to manage some of the transitions that Chris has been talking about. Chris is obviously available to chat to you as well. Oh, he's a very busy man. And I'll signpost you also to keep the home workforce engaged and connected, which was our seminar that we held on Monday, worth a watch, and that's available on our YouTube channel. Now, our next Chamber Live will be next Monday at 2 o'clock. Stay safe, everybody, and enjoy the rest of Wednesday. Thanks a lot.
Thank you, everybody.